Resuming debate, the honourable member for Davenport.
Thank you, Mr. Speaker. I will be sharing my time with the most honourable member of Halifax West. Mr. Speaker, as always, it's a true honour for me to rise in this venerable House to speak on behalf of the residents of my riding of Davenport. I will be speaking on Bill C-31, an act respecting cost of living relief measures related to dental care and rental housing. More specifically, I'll be speaking about how the federal government is working to immediately make accessing dental care for children across Canada more affordable through the Canada Dental Benefit. This is something that's important to families in my riding of Davenport, particularly those who do not have access to dental insurance and whose household incomes are below $90,000. Indeed, Mr. Speaker, Canadians are feeling the rising cost of living, particularly through higher food prices and rent. While inflation is a global challenge caused by the pandemic and Russia's illegal and unjustifiable invasion of Ukraine, it is important for our government to help families weather the impact of higher costs by putting more money back in the pockets of the middle class and those who are working hard to join it. The introduction of Bill C-31 by our Ministers of Health and Housing is a critical step in improving oral health for children and delivering on our commitment to financially help Canadians deal with the rising cost of living. By helping families afford the dental care their children need, this new benefit will support families who need it the most, when they need it the most. Helping Canadian families weather the impacts of inflation by working to put more money back in their pockets this year is a priority for our government. This investment in dental care for children without dental insurance will build on the strategic investments that our government is making to support Canadians by making life more affordable and building an economy that works for all, while at the same time helping our youngest members of society get off to the right start and have healthier oral health while suffering less pain. Since 2015, Mr. Speaker, our federal government has cut taxes for the middle class and raised them on the wealthiest 1%. We have delivered a Canada Child Benefit and raised it every year to continue putting more money back in the pockets of 9 out of 10 families with children. And we will have cut regulated childcare fees in half on average by the end of this year for families across the country. These are just a few examples of how we are delivering support for the lower and middle income Canadians. The federal government has also taken steps to support our universal healthcare system through a one-time top-up to the Canada Health Transfer of $2 billion to the provinces and territories to help reduce backlogs for surgeries, building on the $45.2 billion provinces and territories will receive this year. Our federal government has taken important steps to make a real difference for families across the country, and I'm incredibly proud of the significant long-term sustained investments that the government is making to help deliver a more affordable and better quality of life for families across Canada. That being said, Mr. Speaker, we know that dental care is an integral facet of the overall health of Canadians, and that poor oral health can have costly personal and financial repercussions. It is estimated that the negative impacts of poor oral health accounts for productivity losses of over $1 billion per year, as well as approximately 2 million missed school days annually. This outcome increases public spending in cost-intensive healthcare areas such as cardiac and emergency care. By making dental care more affordable for middle-class families, we believe that the Canada Dental Benefit will help greatly reduce these costly and serious negative impacts. We also know that cost is a significant barrier to accessing dental care for many Canadians. Among children, much of the burden of dental disease is concentrated in children from low-income families. That is why we've introduced this legislation, to break the cycle of poor oral health for the youngest Canadians and to help make sure that families can afford dental care for their children. Mr. Speaker, we estimate that over 500,000 Canadian children could benefit from this investment, and that the cost of this targeted investment is estimated to be $938 million. It is absolutely a worthwhile investment, and this legislation, if passed, will make it more affordable for parents to take their children to see a dental professional so that children across the country can receive the care that they need. The Canada Dental Benefit for children without insurance under the age of 12 will help parents with income under $90,000 purchase needed dental care for their children. The Canada Dental Benefit would provide direct payments to eligible applicants totaling up to $650 per year per child for dental care services for applicants with a family income under $70,000. It would be $390 for those with a family income of $70,000 to $79,999, and $260 for those with a family income of $80,000 to $89,999. Parents or guardians of eligible children who have dental needs would need to apply to access payments. Mr. Speaker, our federal government will be taking action to ensure that Canadians receive the benefit as quickly as possible. This legislation will give the Minister of Health authority to implement this application-based upfront benefit payment to eligible Canadians later this year. The targeted implementation date for the Canada Dental Benefit is December 1st, 2022, pending parliamentary approval and royal assent for enabling legislation. And the program would cover expenses retroactive to October 1st, 2022, so long as the child remains eligible on December 1st, on December 1st. Canadians will be able to apply for and receive the benefit upfront before accessing dental care. Eligible Canadians can apply via the Canada Revenue Agency's Secure My Account portal or by calling the Canada Revenue Agency's Client Contact Centre. Our federal government will ensure that applications will be processed quickly, automatically in many cases, with payments received within a week for individuals requesting direct deposit. And we understand that dental care needs vary from one child to the next, which is why we're providing flexibility for the Canada Dental Benefit to be used for any dental care provided by a regulated oral health professional licensed to practice in the applicant's province or territory. This flexibility will position parents to have discussions with their oral health care provider to determine the most appropriate dental care treatment for their children. Mr. Speaker, it is important to note that the Canada Dental Benefit will not reduce other federal income-tested benefits such as the Canada Worker Benefit, the Canada Child Benefit, and the Goods and Services Tax Credit. Our federal government will ensure that Canadians receive the information that they need to apply for and receive the Canada Dental Benefit. Through a joint collaboration between Health Canada and the Canada Revenue Agency, a public education campaign for the Canada Dental Benefit will be launched and tailored messaging providing essential information on who qualifies and how to access this funding. Our federal government will engage with stakeholders such as provincial and territorial dental associations to promote the Canada Dental Benefit and provide essential information for qualifying families to be able to understand how the benefit will work for them. Recognizing that the Canada Dental Benefit is the first stage of the government's plan for making dental care more affordable for Canadians, I'm pleased to also see that our federal government is committed to providing dental care to Canadians and continues to take needed steps to build a comprehensive national long-term dental care program. And just to remind everyone, Federal Budget 2022 proposes to provide funding of $5.3 billion over 5 years and $1.7 billion ongoing to deliver a dental care program for low-income Canadians and to help provide dental care for Canadians who are unable to access care because of the costs and or because they do not have dental insurance. Mr. Speaker, in conclusion, this legislation strikes the right balance between ensuring that the immediate needs of low and middle-class children in Canada are met, as well as setting the groundwork for a comprehensive dental care program. I know that this benefit will help many families, not only in my riding of Davenport, but families right across the country. And so I ask all members of this House to join us in supporting this much-needed legislation. Thank you, Mr. Speaker.
Great.